Good afternoon, everyone, and welcome to Diapoint ME. And our expert series continues today with Dr. Yousef Said from Glue Care Clinic. And my name is Pam Durant. I am the founder and managing director of Diapoint ME. Today, we are going to discuss Ramadan and fasting and diabetes with Dr. Yousef, and we're so happy that he's here with us today. Before we begin, a little bit more about Dr. Yousef. Dr. Yousef Said is a German board certified specialist in internal medicine and diabetology at Glue Care. Glue Care is a clinic that's recently opened in Dubai, and it focuses specifically on diabetes. From the period of 2013 to 2017, Dr. Yousef served as an assistant doctor at Vincent Pallotti Hospital, Bensberg, Germany, within the Department of Internal Medicine, Hematology, Oncology, and Gastroenterology. Dr. Yousef Said later worked as an assistant physician and specialist in internal medicine and diabetology at St. Vincent's Hospital, Cologne, with the Internal Medicine and Diabetology Endocrinology Department. He has a special interest in the diagnostic and treatment of diabetic foot syndrome. He previously served as the director of the Internal Medicine Department at the AACSH, Dubai Healthcare City. And he's a graduate from the University of Cologne Medical School in Germany. And we are so happy that you are with us today. Thank you for taking the time. And we're really happy that you're here.
Thank you.
So, thank you. And if there's anything else that you'd like to add to your very distinguished bio that I missed, please let me know.
Thank you for the invitation, and my greetings to everybody who is joining us today.
Oh, thank you. So today we want to talk about diabetes and Ramadan, because Ramadan is probably going to start in about a week. Next week, Monday or Tuesday, we should get the notification of when fasting will start. And we all know that this can be very tricky to navigate if you have diabetes. And some people with diabetes even question, should they fast if they have diabetes? So I was hoping that you could start by, first of all, just shedding some light on the topic, perhaps explaining to us what really happens to the body. And the first biggest question that everyone has is, if I have diabetes, can I fast?
Yes, that's of course a very good question. I mean, generally, to first understand what happens if you're fasting is that there are main things. Your sleeping patterns are changing. Of course, your eating habits are changing, and also your physical activity times are changing. These all, of course, can then influence your body, and for type 2 diabetes patients, it can come to glucose fluctuatings, and you can have, of course, then more the risk of high or low blood sugar. So this is the first thing what we have to know. If you're fasting, what happens in your body. The second thing is then to know for you as a person with diabetes, if it's safe for you to fast. And therefore, it's really important, and what I am always recommending is to do a pre-Ramadan assessment, yes, which is really important, which you should do with your healthcare provider. And this assessment includes first a risk qualification. So here, the physician is calculating how much your risk is, and then splitting you into 3 groups. So it's the group of low risk, the moderate risk, and high risk. And we are using the IDF 2021 risk calculator. And this includes, for example, which type of diabetes you have. Of course, what your treatment are you on insulin or on medication? How long you have diabetes, how stable your diabetes is managed, and of course, if you have symptoms like hypoglycemia in the past or DKA, you have maybe other diseases, yes, like blood pressure or other things like kidney diseases. So this is coming all into this calculator, and then we are looking and then giving the patients the recommendation at first step if they can do fasting in Ramadan and not. And the low group, there we are saying if you fall into the low group that you can fast. And if you're in the moderate group, we are already saying you should not fast. And if you're in the high risk group, we will definitely say that you must not fast, yes, because there the risk is then really high. If you're now falling into the low group, then a proper education is really important. So to have a safe and healthy Ramadan also, we have always a care team, which includes always a physician, a nutritionist, and educator. So this group will teach them, the patient, of course, how to measure your blood glucose, yes, what you should drink and eat during this time, what is with exercise, medication adjustments. It's also then important to know when you should stop your fasting, yes, so what is breaking your fasting, if it's dangerous for you. And so this education is really important to give them, the patient who are allowed to do fasting, a really safe Ramadan.
Okay, great, thank you. So if someone's listening and say they go to their doctor to ask about fasting, it would be advisable that a risk assessment is done. But in addition to that, let's say if the doctor doesn't have a risk assessment, then what kinds of questions should they ask to their doctor?
They should ask generally with the treatment they have, for example, that they should do any adjustments. Yes, is it necessary? How is the risk if you're on insulin to get hypo or hyperglycemia? So to understand, and your physician should normally know how your past history is. Yes, to give you also a feedback. Is it for you easy to manage your diabetes already before Ramadan? Yes. Or already there are any issues, so that you as a physician would say, look, you already have pre-Ramadan problems to manage your diabetes, so it's not a good idea to do it already, to do fasting in Ramadan. So these are important things. And again, as I mentioned to you, it's important to get a holistic picture of yourself. So your physician should know what your working environment is, how the stress level for you is, and again, duration of how long you had diabetes, and important is other diseases what you should have. So you can ask then your physician, look, and what you know about my past medical history, generally, would you recommend it for me to do it? And then with the medication and the treatment on which I'm current am, and you know how my management is it really for me safe to do it? Yes. And then again, the questions are how I should do it, yes, and what is the most important things, as I mentioned, when I should measure my glucose, what I should eat. So these things will be definitely important to get from your healthcare provider.
And would you say it's, I'm assuming, but more riskier for type 1 versus type 2 diabetes, or they both share a similar risk depending on the person?
Yes, I think it's mostly really individually. There are studies, for example, showing that especially type 1 diabetes patients who are on insulin therapy, that the risks get higher for hypo and hyperglycemia during Ramadan. This, the study is already showing. With people for type 2, for example, most of them are on oral medications. And these oral medications are mostly very safe medications, which if you take really proper care, don't make any hypo or hyperglycemias. And type 1, it's a little bit difficult. But most important, again, is how you are pre-Ramadan. Yes, so if you're a well-maintained type 1 diabetes patient, yes, who can self-manage him already very good and has really less complications, no really hyperglycemia in the past future, then your risk, of course, is low. Also, you can have a safe Ramadan. Definitely, yes. So it depends only on the patient on itself, and that's what we are saying. I'm sitting then with you as a patient to find for you the best solution. Yes, and I would never generalize it and say because you're type 1 or you're type 2, you should do or you should not.
Right, because like we were discussing before the call, no two are ever alike, right?
Yes, true.
And so leading up to the day Ramadan begins, in addition to maybe medication adjustments and other things, Are there some things that people with diabetes can do to help prepare them for fasting?
Look, we are already generally saying that you should meet few weeks before, yes, your healthcare provider to discuss this, yes, to already educate you. You should know what you should do when Ramadan starts, yes, and even sometimes maybe a week of some days of trial is maybe helpful, yes, and important is now how you're connected with your healthcare provider, yes? Because if you have a close contact with them through remote management or other systems, you can get really immediately feedback of that, what you're doing. And so if you do some, for example, agree with your physician to say, okay, I will do now a weekend and start to do a Ramadan trial to see if we make these adjustments, how it works on me, yes? Do you see anything, and is it for me easy or difficult? So these adjustments should already maybe to be tried and done before, yes? So the patient on itself, it's like a training, yes, before you start a tournament, yes? So therefore it's, I think, important to use really a time, at least a few weeks before Ramadan, to discuss these topics, to get the proper education, and then we need to start safely Ramadan.
Okay. And I saw something in the guidelines where it talked about a Ramadan nutrition plan. Can you tell us a little bit about that?
Yeah, it's a really nice tool where everybody can go on this website, and there's also for each region different types of meals where they're suggesting. And so there is a nutritional plan telling you how much carbs you should intake, how much proteins you should take, and fats you should take in Ramadan. And then, of course, the quality of what you're eating is important. So therefore, they're giving you then suggestions for these meal plans, yes, with the calorie intake. So for you as a man or as a woman, how much calories you should have, yes, to, for example, also not gain weight, yes, but sometimes also happen in Ramadan with patients, because we have often the problem that we are fasting during the day, and then at the night we are unfortunately craving food, yes, which is also not the idea of Ramadan, to be also honest, yes. So this is, of course, again, these things are all management things, and this meal plan, which is again available for everybody who can create this online for themselves with the suggestions what they are giving. It's a really helpful tool.
Yeah, we just had a question of someone asked, what is the name of the website that has Ramadan nutrition tools, Reham? That's the IDF guidelines, and in the show notes, we'll share the link, but idf.org. Basically, if you just go to Google and you type IDF and Ramadan, the guidelines should come up for you. It's a pretty comprehensive document.
Ramadan nutrition plan. If you give this also, it will come normally.
Okay, wonderful. So that's wonderful. And then another question. So because people are thinking fasting and fear of hypoglycemia, is it okay then for people that have diabetes to exercise during Ramadan?
That's also, again, individually, but we are generally saying that you should avoid to do really heavy exercise, yes. You should avoid, especially the 2 last hours before the iftar, exercise. Mostly we are saying if you want to do exercise, do it after iftar, but not really heavily. Yes, and this is the most important thing. For athletics, it's then really a different topic, because it's something where you need really proper management. And then again, it's important to have days before Ramadan. Yes, you do trials to see what you have to adjust. Dehydration, so fluid intake is then really important in these things. Generally, the guidelines are saying you should not avoid exercise, so not avoid physical activity. Yes, so I would not say to everybody you should avoid even to walk. No, this can be definitely something good, but it's important to understand the limit. Yes, and this is again something where we can go together through it and see what the patient is doing, how long he's doing. And then, of course, the recommendation is to reduce it, definitely.
Okay, wonderful. Yeah, so it's definitely probably, I'm assuming, similar advice. If you were doing it before Ramadan, then maybe you could continue. It's not the time to start a new intense exercise program.
Definitely not, yes. Because again, the most important thing is we want a safe Ramadan, yes? So we want to avoid hypoglycemia and hyperglycemia. This is always the important thing. It's not a Ramadan if you bring yourself in danger, yes? Then therefore this is important. Everybody who wants to fast in Ramadan is to know that generally our religion is saying, if you know it's dangerous for you, you should not do it, yes? And therefore, I think it's important to have this assessment, yes, to really show we are trying to show this with our patients so they're really clearly understanding them, what is the best for them.
Since you've been using the assessment and having the 3 levels, do you find that that really helps your discussion with patients that you might consider really high risk that shouldn't fast? So do they does it make sense for patients? It might make sense for doctors, but sometimes for practical purposes, maybe for patients, does it help?
The thing is with what we have newly is a lot of data, yes, with the growing of digital technology and with the use of CGM, we have better studies, yes. And to keep this simple and simple matters to show this to patients, I think this can be helpful. As if I show them any study, they will not understand. But if I told them that 30% have the risk to get a hyperglycemia, yes, then hopefully they will understand that they can get them in a risk, yes, to have a bad reaction. And there are people, I mean, even the guidelines is saying that, for example, for pregnant women, yes, Ramadan is not should not be done, but there are still women who want to do that. So the guidelines is then mentioning for those who really want to do it, what you should do, yes. So we will have maybe patients who will still be in a high risk category and will say, I still want to do it, yes. And then still we will try to educate him as much as possible, yes, to tell them, okay, this is now your responsibility, yes. We are saying to you, you should not do it, yes. But if you want to do it, please have this education. You should know what is signs for hypoglycemia and hyperglycemia. So you have used this science, you should measure your sugar. You should then frequently measure your sugar. We will tell them when to do this, yes. So I think there will be some patients who will still not follow the recommendations, but then it's more important really to take care of them, yes, and give them to not say, okay, it's now your decision, you can go. No, okay, let's then at least help you. And maybe then if they see also that they're bringing them in danger and we can give them immediately this feedback, then maybe we'll then stop, yes. So again, there are then a tight connection with the patient through, for example, remote monitoring platforms are really important.
Great. So to help them try to fast in the safest way possible and while you're there and you're monitoring. So gestational diabetes, extremely high risk. But
also all pregnant women who even don't have gestational diabetes, yes, for them it's the same. And diabetes patients who are getting pregnant, yes, who want to fast, for them all, again, the risk is there, yes. It's not a recommendation to do it, because if you would go the risk score, they will already at least reach the moderate level, and there we are already saying you should not fast, yes. So therefore, but again, we will not let any patient alone if he decides to fast, yes, and we will try to help them to get as safe as possible through Ramadan.
Wonderful. Is there a particular number that is recommended, a blood glucose level that is recommended? I mean, obviously a severe low, we're, needing to break our fast and have some fast acting sugar. Is there a particular recommended level that you're telling patients, or the guidelines are saying this is when you should medically break your fast?
Days. So if you're less than 70 or over 300, you have to break your fast. Yes, that's really clear in the guidelines. And this is again because we want to avoid any damages to the patient.
Okay. So over 300,
And
drinking water. Yeah.
Yes.
Okay.
Then you have to, I mean, you can always, this is important. You even can take your insulin during your fasting. Insulin is not breaking your fasting. This is really important to know for the patients, yes. But if you are, from the experience and the studies, what we have done, it says that if you're going over 300, then it's better really to stop the fasting.
Okay. Okay. So then, now let's say we fasted, we made it successfully through Ramadan, and then it's Eid. Are there guidelines or suggestions of what to follow as everyone comes back into eating throughout the day?
Yes, I mean, this is the biggest problem. Then we have the Eid days and the days after that. Yes, because in the Eid days people are meeting each other. It's a lot of what we are eating, a lot of sweets. Yes, so I mean, we have to understand that it's important to implement in our society also to say there are some type of people who have to control themselves. Yes. And you should not be angry because he's not eating with you, or maybe he's eating lesser than somebody else. And our culture, sometimes if you have a guest and he's not eating and he's eating not even much, you're sometimes not feeling comfortable. Yes. So it's for the guest and those who's inviting you. But I think this is also in education with time, what we have to understand, that even that if it's Eid days, we still have to try to control ourselves. For type 1 diabetes patients, they can get really quickly then to hyperglycemias, which can be dangerous. And after the Eid days, it's definitely then important again to meet your healthcare provider to discuss what you was facing, and of course the adjustments of the medication again. What we are already given also before, what they should do after Ramadan. But it's, I think, a good feedback on itself to sit with the patient then together and adjust and see, hopefully also even to get an improvement of their diabetes management. Some of them, yes. Some of them can improve, yes. And there are even a small study which was even shown that those patients who are going to Tarawih have a better management because they're doing a little bit exercise. Yes, this is also a type of exercise what they're doing. Yes, and they have a better outcome. So everything is really complex, but I think with a good structure, you can manage it, and with a healthcare team behind you, which is reachable for you even in the times of Ramadan. Hopefully, you can have then a safe Ramadan.
Great. And it probably also goes without saying as well that patients can go visit their doctor during Ramadan as well if they need to make some changes.
That's the thing. We are, of course, we are available for our patients in the clinic. And again, with if you have a system like we have with the remote monitoring platform, you can be even in chat, in contact with the patient all the time. Yes. So it's giving yourself also then a better safety, so that you know somebody is there, and I have any questions, any issues, I can ask and hopefully get then the right recommendations.
Yes, even for, I think, some people that are in the call, if you may not be seen by a clinic that has remote monitoring for glucose monitors, but I know a lot of doctors, they will give you their WhatsApp number or different things like this, and email, and don't be afraid to reach out and ask questions if your doctor has shared that with you, because they're happy to support you.
Definitely.
So I'm going to open it up for questions now. If anyone has any questions, I've asked all my questions. Or Dr. Yousef, if I forgot to ask you about an important part that you'd like to share.
Well, again, we spoke about the most important things. As I mentioned, really, it's as a simple summary to say, please do your Ramadan assessment as at best few weeks before Ramadan starts, so you will get the right feedback of your healthcare provider. How generally before you start, is it really risk, how much your risk is, and then a right education, a right nutrition can help you definitely to have a safe and healthy Ramadan.
Wonderful. I've shared actually the link of the guidelines. It's for healthcare professionals because I had it open. I was reading it earlier today, and it's a lot of detailed information that you'll probably have a lot of questions with after. However, don't be afraid to reach out to your healthcare providers, or you want to reach out to Dr. Yousef. He's at GluCare. You can send Diapoint the question and we'll pass it on. So please have a look at that. And the risk assessment is in there as well, which I found very insightful and interesting. Any questions? Comments? Very quiet today. I think it's the shock that it's already April 5th, and I don't know how the first 3 months of the year have gone, and Ramadan is going to be just a few days away.
Yeah, it is. Again, I think generally I'm very happy to join this day today because this awareness should be there over every diabetes patient, yes, that there's a help with your healthcare provider, that they can help you with this types of assessment and management and education, and you should use this opportunity. Yes, you should really use this, and hopefully if there's again any questions also for later, you can reach us out.
Yeah, please send. Okay, so someone sent me the question. So if I am a type 2 diabetic, can I fast?
You can fast again after the risk assessment. Yes. So if I see you, I make the calculation, I know your past history. Then after that, if you fall under the category of low, then yes, you can fast. And then it's important, if you're under medication, to give you the advice when you should take your medication, to iftar, to suhoor. These things are then generally important. Again, as I told you, most of the oral medications you can take very safely. There are some you have to take care of. But yes, this is something what is for everybody. Again, to first have the category where you're falling in, and then I can tell you, you can do fasting or not.
Yeah, and there's the follow-on question. Then if I'm above 300 levels, so am I in a dangerous amount of blood sugar?
You are definitely, yes. For diabetes type 1 patients, you can get into a ketoacidosis, which can be really a dangerous condition, which can go into coma. And the same is for type 2 diabetes patients. They can get a hyperosmolar coma. So it's definitely important. That's what I say. They took the cutoff of 300, because through the time with the studies, what they have seen is that if patients are going over 300, then the danger is to get this severe complication is already high. So then you should really stop to do fasting.
Is there a number for, I just thought of this question, is there a number for people with type 1 diabetes where they should start checking their ketones?
Generally, what we are saying, if your sugar is going over 240, you should start to check your ketones. Yes, 250 is then with ketones already a DKA. Yes, so therefore, generally, and especially in the time of Ramadan, you have to take care of that. And if you reach these levels, please check your ketones.
Okay. Yeah, I think the question about the 300 blood sugar, I'm assuming this person's a type 2 and not a type 1. But based on what Dr. Yousef has shared with us, I don't think anyone wants to be at a 300.
Look, I've seen already a patient who's coming to me, and he is in these levels regularly every day. then I will not tell him to do Ramadan, because he's not in a low category. He's unstable, yes, and he needs this stabilization of his time and range and of his glucose. Then you can have a safe Ramadan. That's important. It's really, really important to know that this fasting is bringing you nothing, yes, if you bring you under danger. And not only from the medical, also from the aspect of religion, yes. It's clear and announced every time and everywhere that fasting is only for those who are not bringing them in danger, yes, and health danger. And therefore, it's important to understand this.
Great. So, any other questions? No. And I would say for the document that we shared, it is for healthcare providers and doctors and professionals. And for people that have had diabetes for a very long time, it's probably very easy to understand this document. However, it's not a decision that we should be making on our own. You can review it, review the assessment, but still please go seek medical advice to make sure that you're doing it safely, because the doctor or nurse educator or whoever it might be is there to look at it objectively for you. Because sometimes when we look at our health, we might think we're doing okay, but maybe we need some medical advice to tweak it and make it better and make sure we're doing it healthy. So I definitely want to say, you know, don't make any decisions without taking medical advice. I send these documents to everyone just so then it always is a good starting point for a place to start the discussion with your doctor. I think they're amazing for that. And it gives you a little more information, because sometimes doctors don't always have the time to go through a 20, 30-page document with you, but you can read it before and then ask the questions that you want to ask.
I agree totally. And again, I'm generally always saying diabetes is not because I'm a great doctor or I'm giving you the best medication. It's a management disease. Yes. And as much you learn more about your disease and you much better get with your self-management, this should be the goal of every doctor for his patient. Yes. Because this is what I want, that you understand what you have. You understand what is harming you and what is the benefit for you, because this is the only way also to have a long-term good effect and to reach something where you can have good results for your patient.
Okay, great. All right, if no other questions, then I think we will wrap up our discussion about diabetes and Ramadan. Oh, a question just came. Wonderful, makes me happy. Okay, hi, my daughter is 11 years old and this Ramadan will be her first with diabetes. The past years she used to fast, so any advice?
Look, if you see, besides from healthcare system, even in the Islam, it's saying you should fast starting with puberty. So she is 11 and this is normally 14 to 15. So in my opinion, that's too early to start with Ramadan. Secondly, again, so she will already go through this in a moderate classification of risk. Yes, and then again, it depends. If you still want to do Ramadan, then it's important to have the proper education. Yes, then it's important really to understand, especially for the children's, what a hypoglycemia sign is, why the hypoglycemia sign is, to be aware of this, and for the parents also likewise. I'm not personally recommending it in this age, but if you really want to do it, then please get in contact with your healthcare provider, get your recommendation, and get really a proper education.
Very good. Yeah, especially probably the first year, depending on how long ago she was diagnosed. I imagine that could be quite tricky without Ramadan.
Yes, you can have already challenging. Yes, definitely.
Okay, any other questions?
Sorry to disturb you. You should at least have experience with your disease, yes, to start with Ramadan, yes. If you're also newly diagnosed, yes, with diabetes, and then starting with Ramadan is, I think, not a good idea. Yes, because this is the time of adjustment. This is the time to get you on a normal glucose levels, and Ramadan can make it difficult.
Challenging for sure. Thank you so much. She was diagnosed in June 2020, so almost a year.
It's, yeah, but it's still very early, yes.
I think so. All right, any other questions? Okay, thank you so much, everyone, for joining us today. And thank you, Dr. Yousef. I really appreciate you joining us and being here and sharing your wisdom and your experience with us about diabetes and Ramadan. It was a very informative session, and I think the sign that there wasn't a lot of questions means that we covered everyone's questions. Again, if you need to ask a question later, you can send it to info@diapointme.com, or you can reach out to Glue Care Clinic where Dr. Yousef is working. We hope to see you again at our next expert session. We'll let you know when that's happening. And thank you, everyone. And if I don't talk to you before, have a lovely, wonderful, safe Ramadan.
Thank you very much. Thank you for the invitation.
Thank you.